Well, September is Perimenopause Awareness Month, and if you are a woman in your 30s or 40s, you may want to listen up. In today's The Doctor Is In segment, endocrinologist and social media influencer Dr. Salas-Whalen is here to answer all of our questions about perimenopause. Thank goodness. Welcome to the show.
Thank you
Dr.
so much.
Salas.
Thank you.
First and foremost, this is, it's all anyone seems to want to talk about, and with reason, because I think for years, perimenopause and menopause has been ignored. We've had doctors on the show say they spent maybe 2 months when they were in medical school on menopause. So right here, what is the difference between perimenopause and menopause?
Menopause is when you don't have a period for full 12 months, so 1 whole year without a period.
Okay.
Perimenopause is the stage that happens prior to that year, and is where we see most of the symptoms.
Really? Symptoms like?
So,
because I'm asking this on purpose because I feel like you could have an itchy ear and that might be a symptom of perimenopause.
so we have from the most common to the very non-common symptoms, right? But I would say the most common is changes in your menstrual period.
Yeah.
Not necessarily that you skip a period, just your cycle may be different.
Okay.
Trouble sleeping, and is the staying asleep, not the falling asleep. Is waking up at 3, 4 a.m. in the morning like clockwise.
Yeah.
Vaginal dryness, pain with intercourse, changes in your mood, depression, anxiety, hot flushes, night sweats.
It runs the gamut. Is there a specific age where perimenopause begins?
So the symptoms in perimenopause can happen up to 9 years prior for the period stopping.
Really?
So, yes.
9 years prior.
9 years prior.
Is there any real way, or let me reframe this, what is the most scientific or most secure way to know that you were in perimenopause? Is it a blood test?
So we don't diagnose either perimenopause or menopause chemically. It's a clinical diagnosis. So we really base on age, symptoms, family history, what age your mother went through perimenopause or menopause. That's really going to determine where you will go through it.
I talk about this in my family. My sister is, she wouldn't mind if I said this, she's 59, I'm 50. She has gone through menopause. Our mom and our aunt both went through menopause, obviously. They're both in their 80s. My mom, we had no idea she was going through menopause. My aunt, she had hot flashes. It was this whole big thing. I wonder if you can tell us, how do you know, can you even prepare? I'm hoping I go softly into the night like my mother did, but I might not. So is there any way of knowing what you're gonna come up against as a woman?
Definitely. So symptoms are gonna be very different in every woman, right? We're very individual. So even not everybody's going to have the same laundry of symptoms that we hear about. Number 2, education, right? Knowing that the age that you are, the symptoms that you're seeing, keeping track of your cycle, talking to your doctor, the earlier, the better.
The earlier, the better. Should we treat perimenopause, or do we wait until are we actually in full-blown menopause?
So the whole purpose of hormone replacement therapy is to treat the symptoms, right? So if you're in perimenopause and already having symptoms, that's where we need to start hormone replacement therapy.
Which brings me to my next question. Hormone replacement therapy, HRT, if you know, you know, it's been a hot topic in treatment. Can you break it down for us? What is it exactly?
So we're really trying to replace and mimic what your body was doing naturally, producing estrogen, progesterone, and in some cases testosterone. So we're replacing what you're not making anymore.
Is there anyone who should take it, anyone who should avoid?
So things have changed a lot. So now currently we have one contraindication, one absolute contraindication is if you yourself have history of estrogen receptor positive breast cancer. But anything beyond that, it's possible to be on hormone replacement therapy.
And for that answer, you would have to go to your physician to understand 100%. What your physiology is.
Yes.
Can you start hormone replacement therapy at any age?
So we have a window of treatment, which is 10 years within your last menstrual period. But if it's been more than 10 years of your last menstrual period, there's still a possibility that you can be on hormone replacement therapy. You will just need a good cardiovascular assessment risk by your doctor.
Go to your doctor. I actually was in an hour-long conversation with 3 of my best friends last night, and we all had different things to say about hormone replacement therapy, which means you'll have to come back. and follow up
Definitely.
and tell us all the things. Thank you so much for joining us. A lot of fantastic information. And you at home, if you want more information on how to reach Dr. Salas-Whalen, go to nyendocrinology.com or follow her on Instagram, Dr. Salas-Whalen, over there on the gram.